Assalamu alaikum. Hello, everyone. Unlike other sessions, in this session, the heart and systemic disease, you will have four moderators. Myself, Professor Ashraf Barakat, Professor Fatma Al-Wakil, and Professor Shaimat Mustafa. As for me, I will be covering the heart in the elderly population. Aging is a unique experience. Some age gracefully, others age prematurely and may possibly become totally dependent. Not only that, but they also have to deal with psychological challenges like retirement, death of friends and spouses, and possibly even living alone. Treatment in this age group needs to be kept at minimal, as it is mostly not evidence based, since most trials do not include the elderly age category. Remember, do no harm. The following slides contain broad headings, and hopefully some of them will intrigue your interest for further exploration. So let's start. Prepare paper and pen, and when you see a picture of body system, click pause, jot down what you know about the processes that occur in that system, and then continue playing. If you've written or dug up more info than what is presented on the slide that follows, make sure to share it with us in class. Cardiovascular system, pause. Heart failure, diastolic and then systolic. Wider pulse pressure, decreased cardiovascular response to exercise, atrial and ventricular ectopy, and low AF. I'm sure most of us got this, if not even more. Respiratory system, pause. Decreased lung elasticity and vital capacity. Reduced baseline oxygenation in response to supplemental oxygen. Increased risk of aspiration. And decreased cellular and humoral defense. The nervous system, increased alpha adrenergic response, decreased beta receptor number and response, dopamine receptor number, parasympathetic muscarinic response, signal transduction, sensations, psychomotor response, reaction time, memory and cognitive impairment, the 3Ds, delirium, dementia, and depression. So how are we doing so far? Endocrine system, pause. Increased incidence of diabetes, thyroid abnormalities and skin changes, bone mineral loss, water intoxication, and fracture risk. Decreased estrogen and progesterone, testosterone, and growth hormone secretion. GIT, pause. Hepatic changes, decrease in hepatic mass, hepatic blood flow, CYP450 enzyme activity with changes in drug levels, constipation, diarrhea, loss of teeth and taste sensation, increase in diverticulitis incidence, and rupture. Sight, pause. Decreased light exposure, perception of quick movements, color perception. Increased pupillary reflex time, incidence of cataract, sensitivity to glare. Hearing, taste, and movement. Hearing, loss of high-frequency hearing with decreasing ability to recognize speech. Taste, decrease in smell and consequently taste and appetite. Movement, degeneration of cartilaginous tissues and fibrosis, and loss of tissue elasticity. Cellular and immunological changes. Cellular changes, accelerated cell senescence, increased DNA damage with decreased repair, decreased oxidative capacity, increased fibrosis and lipofuscin accumulation. Immunological changes, increased susceptibility to infections. So even though you have an increase in the T and B cell antibody count, they have decreased cell functions. Mass changes, pause. Changes in body drug levels, decreased strength, decreased creatinine values, dehydration, increased adipose tissue till about 60 and then followed by a decrease thereafter, impaired thermoregulation. Perioperative implications, pause. Narcotics and diuretics may decrease venous filling pressure. Positive pressure ventilation and volume depletion will produce profound changes on the stroke volume and cardiac output. Calcium channel and beta blocker medications will yield an exaggerated negative inhale and chronotropic effects with inhalation anesthetics. Perioperative hypotension is more frequent and more severe than in the younger populations. Any fluid overload could easily precipitate heart failure and pulmonary edema. So, you have to keep in mind that no one can possibly ever master everything, and that's what andragogy is all about. As adult learners, we learn what we need to learn. So that was part of your knowledge acquisition, waiting to see you in class for knowledge implementation. See you soon.